Hello, everyone, and welcome to another Primed Academy webinar. I'd just like to start by acknowledging that we reside and conduct our business on Treaty 6 territory in the homeland of the Métis. We pay our respect to First Nation and Métis ancestors at this place and reaffirm our relationship with one another. I am so excited today to be bringing you the Saskatoon Community Commitment. My name is Steph Klochuk, and I'm the Vice President of Tourism Saskatoon. And this is a project that we have been working on for quite some time. I want to start by saying thank you. Thank you for everyone for doing your individual parts to keep us all safe. I want to praise the readiness and solidarity of our sector in supporting the response to the health emergency by closing their doors or completely augmenting your operations to continue to provide service. You have demonstrated leadership, resilience, and compassion. Thank you. Our work to develop the Saskatoon Community Commitment is an effort to honor the hard work and dedication to making Saskatoon a great place to be and to be from. Tourism Saskatoon keeps our community at the heart of everything that we do, and this is no different. As the province of Saskatchewan launched the Reopen Saskatchewan plan, we knew that as a destination we must provide additional support to ensure businesses had the resources required to develop their own internal controls that prioritize the health and safety of their staff, and thus ensured safety and security for their customers, our community, and the visitors of our future. The process that we are launching today starts with this webinar that you are all about to experience, and that was created by our partner, Robin Reist. Her experience has been invaluable as we work to support the navigation of all reopening recommendations. In watching this webinar, you will learn how your business can mitigate as much risk of COVID-19 transmission as possible, or check the already implemented controls that you have. This is an opportunity for you to feel secure in the decisions that you've made in your business, making sure that all of your staff are as safe as possible. Following the webinar, you will have the opportunity to download a worksheet document. If you haven't received this, please contact Tourism Saskatoon and we'll make sure that you get them. Once you've completed watching the webinar and working through the worksheet, you are ready to become a Saskatoon Community Commitment Partner. We will provide follow-up details as to where you can request the printed commitment that you can hang in your business, the digital graphics, and window stickers. All of these can be accessed through our website. When you are finished this process, fill out the form on our website and we'll send you everything that you need. I have learned so much from Robin, and I'm honored to introduce her to you all now. Robin is a registered professional engineer, receiving her Bachelor of Science degree from the University of Saskatchewan. She worked at Cameco for 7 years in 3 different roles: as a radiation specialist, internal management systems auditor, and health physicist. She recently completed a master's in community and population health science at the University of Saskatchewan in the College of Medicine. Her work as of late has been with RCH Consulting for over just over a year, where her project focuses on the mining industry. Her specialty is in occupational hygiene, which means largely invisible hazards that can cause long-term health conditions, which has lended so incredibly helpful to this project for our community. In addition to thanking Robin, I want to thank the group of individuals who came together as our safety task force. This was a cross-sector effort that has led us to this point today. And without further ado, it is my pleasure to introduce everyone to Robin Reist. Robin, take it away.
All right, thanks, Steph. And thank you everybody for tuning in. This webinar today is called Thinking Beyond the Mask. And the reason I titled it this is kind of a play on thinking outside the box in terms of COVID controls. And so it's all about implementing how to actually sort through everything and actually implement COVID controls for your workplace that you know will be effective and that will actually work well for your business. And so yes, it is part of the Saskatoon Community Commitment. This isn't the only part of it, but this is a step you can take to help educate yourself and learn about kind of best practices for implementing controls that people use in other industries. And it is a way that is known to work very well. So the learning outcomes of this webinar, hopefully you'll be able to, this is what I want you to get out of this, is to be able to define what is a health and safety risk assessment and also identify what the transmission risks are for COVID-19 and how it's potentially transmitted between customers or workers, and then combine those two things and learn how to apply the risk assessment process to actually develop meaningful and effective controls for COVID-19 transmission risk in your unique business. And then also I'm going to talk quite a bit about just understanding the limitations of less effective controls like PPE and procedures and rules, just so you can have a better idea of what controls are going to work well. And then we'll go through the worksheet, risk assessment worksheet that we've put together, a couple of examples there. So if you, as Steph mentioned, if you don't have a copy of that, you can request that from Tourism Saskatoon, and it should hopefully help you in developing your COVID-19 controls. So what is a risk assessment? This is just a very common practice that's used in a variety of industries. This is not anything that I have invented or anything like that. It's not proprietary. But what we have done is we've taken a very common practice and developed a kind of modified, simplified process for it, just to specifically think about COVID-19 risks. You may already have a well-developed, risk assessment procedure that you use in your business already. And so if you do, this doesn't necessarily override it or anything. This would just maybe serve as a bit of a refresher or help complement it. And also, this webinar is not meant to conflict with the Reopen Saskatchewan guidelines or any other guidelines. It's just a process that you can apply to help you kind of sort through all the things that might be confusing or you not understand why you have to do them. And it will just help you understand why certain controls may be necessary or not necessary for your business. So in Reopen Saskatchewan, there's a section that says do a walkthrough of your business and look for all the places that you might have transmission risk and put something in place. And this is just the process that can serve as that walkthrough that you're being asked to do anyway. So the risk assessment process, when it's really broken down, simplified, it's just kind of 3 steps. First step is identifying the hazard. So the hazard is the thing that could potentially cause harm if nothing is put in place to control it. And then you ask the question, so is it possible for the hazard to cause harm if there aren't any controls in place? And this is the risk, if it is possible for it to cause harm. And then the third question you ask is, how can we best minimize that risk? So a little graphic I have on the screen of this guy slipping and falling. The hazard is the wet floor, and the risk is slipping and falling and potentially getting an injury. And so then how do we best minimize that risk so that he is less likely to slip and fall on the wet floor? So the way that, the best way that is kind of well established within the health and safety industry to help minimize risks in the best way possible is something called the hierarchy of controls. And you may have seen this before, you may have seen it shared on social media, or if you've ever taken any kind of safety training, you've probably heard of this. The graphic I have here is from NIOSH, the National Institute of Occupational Safety and Health in the US. They have a lot of literature on this, and I think they've done quite a bit of research into developing the hierarchy of controls the way it is pictured here. You may see modified versions of this as well. I've seen it. It's pretty common for elimination and substitution to get combined, for example. So if you see something different than this, it's still in the spirit of the same thing. So the way it works is you want to always start from the top when you're developing controls and put things into place that will be most effective in mitigating the risk of the hazard causing harm. And so elimination is the top. And so if you can completely remove the hazard from the system, then that's going to be the most effective way to control that hazard. If that doesn't work, you move down to substitution, which would be maybe replacing the hazard with something less hazardous. Engineering controls is all about designing the hazard out of the system, or in other words, isolating people from the hazard. Administrative controls and PPE down at the bottom where it's yellow and red, these are the ones that start to get, as it says, least effective, because these are ones that really rely on human behavior in order to be effective. So changing the way people work would be like training people to not go near the hazard, for example, or putting up signs saying, warning, this is a hazard, be careful. And PPE is about putting something, like, you know, the hazard is still in the area, but you're putting something on the person's body essentially to try and protect them from the hazard. And these rely on people using these systems properly, whereas elimination, substitution, it isn't always necessary that people use something properly because you're controlling the hazard at its source more than at the person that it may affect. We're going to go back to the hierarchy of controls a lot during this presentation. And so back to that question of how can we best minimize the risk? And minimize is a really key word, because unless you're totally fully using elimination on the hazard, you cannot really be sure that you're actually preventing the risk from ever occurring. You're not reducing the risk to absolutely zero. There will always, pretty much always, going to be some risk, and that is important to keep in mind. And as a result, like, you shouldn't be telling your customers or staff that you are implementing controls that are going to guarantee their safety, because guarantee, the word guarantee to me means that you have removed all risk, and that's really unlikely unless you are implementing those elimination type of controls. The good news is that the more higher level controls that you use, the more effective your risk reduction is going to be. But again, it's very likely never to be zero, and people just need to be aware of that. So the word effectiveness was shared on that previous slide about the hierarchy of controls, and I used it a lot. And basically the definition of what it means is it's just sort of like the degree of foolproofing or mistake proofing or idiot proofing, however you want to say it, whatever's going to stick with you. Feel free to use the term that works for you. But basically at the top, you're going to have less rules to follow, and less rules mean that's less. It's more mistake proof. People aren't going to make mistakes if they don't have to follow any rules. Whereas as you get closer to the bottom, administrative controls like training and procedures and personal protective equipment, these are going to have a lot more rules to follow, and more rules mean more mistakes potentially. It's not because people are stupid or anything like that. It's that even the most best of intentioned people can mess up, and especially if you've got a totally different set of rules to follow for every business you go into, it's just going to get fatiguing and tiring, and maybe people will start to get complacent because there's just too much to think about. And so you want to be implementing the more effective controls that are less mistake proof, less rules to follow, so you don't have to rely completely on human behavior and people being totally on top of everything all the time to keep each other safe. So before I totally get into COVID, I want to talk about, just do a really simple example of a risk assessment for one that everybody would be familiar with in their home or their business. And so we're just going to talk about that wet floor again. So the hazard of the wet floor, the risk of associated with this is that without controls, a worker or a person or a customer is likely to slip and fall and might get injured. And I will just mention, in a typical excuse me, risk assessment, you usually have a rating of likelihood and severity, but because we're really simplifying this process for COVID-19 and we don't know exactly kind of the likelihood and severity type of things yet because it's such a new hazard, I'm just removing that from this process to simplify it. So anyway, once you've identified the risk, then you ask the question, how can we best minimize the risk? And you want to start thinking about what kind of possible controls you can put in place using the hierarchy of controls. So you also want to consider feasibility of these controls when you're thinking about them, which would be costs and social factors. And I will talk about that more on the next slide, but you probably start to kind of see what that means as we go through this. So a way to eliminate a wet floor would be, don't wash the floor. Is that feasible? Can you just never wash the floor? Like, probably not. So maybe elimination isn't really feasible in this case for you. So a way to substitute could be, maybe, can you clean the floor with something that doesn't get it wet? Maybe that's possible, or maybe that would be like way too prohibitively expensive, so then you have to think about something else. A way to engineer out the hazard here would be maybe to lock off the area if that's possible until the floor is dry, or at least put up barricades so that people physically are prevented from getting into the area unless they actively decide to not obey the barricades and like step over them. But that would for most people, it would prevent them from going into the area. If the area is too big, you don't have barricades, anything like that, or you want to start layering controls to warn people a bit more, administrative controls would be things like putting up a caution wet floor sign to warn people. But as you can see, that's going to be a little less effective because people might not see the sign, or if you don't take the sign down when the floor is dry, then people may start ignoring the sign because they don't think that it's there for any kind of reason. And if all of this isn't going to work and you still think you need some sort of control, then I don't know if this even exists. I'm just making this up, but like PPE for a wet floor could be like boots with very special grips on them that people don't slip on. And as you can probably imagine, this is, again, potentially just not a great control, because then you as the employer would have to buy all these boots for your workers, and they would have to remember to put them on every time they're going on a wet floor, and they might not use them because they're like, well, I'm just going to run in the area for 2 seconds. I'm not going to spend 10 minutes putting on these special boots. So that's just kind of some examples of how those lower level controls can get a little bit cumbersome. So back to that feasibility, so costs and social considerations are kind of the main things to consider with feasibility. So cost is, can you afford it? And not being able to afford it doesn't necessarily give you a free pass to ignore the risk, but it does mean that you should come up with some sort of alternative control and not just be like, well, I can't afford it, so we're not going to do it. That's not really appropriate. And the social consideration question is, can you reasonably expect your customers and staff to be able to adapt to putting this control into place? And if they can't, that doesn't necessarily mean they're jerks and they just don't want to. It may be something that doesn't work for them. And if people aren't going to come to your business because they don't like your controls, again, you have to come up with an alternative control that's going to keep bringing people in the door. So now moving into the COVID-19 transmission. So if we're doing a risk assessment for COVID-19, the hazard itself is actually the SARS-CoV-2 virus, and the risk is that the SARS-CoV-2 virus will get transmitted and cause the disease of COVID-19. And so there's a couple ways that COVID-19 is potentially transmitted. The main way that it appears to be transmitted is person to person. So this really should be your priority in developing your controls for your business. And there's maybe 2 potential ways that this happens. First would be transmission via large respiratory droplets. So like if somebody coughs or sneezes and you inhale that right directly from them, that would be kind of like a one-shot thing. Or from small respiratory droplets, and this one has to be more from prolonged contact, such as a conversation taking place over at least kind of 20 minutes or longer in a poorly ventilated space as well. So there's those 2 ways, and you'll see a lot of things where like government officials and public health people will say like avoid crowded areas and prolonged contact and prolonged talking and singing and stuff like that, and that's what they're talking about. The second way, and this is why we do all the cleaning, is the surface or contact transmission, which would potentially be from touching something that has an infected person's respiratory droplets on it and then touching your own mucous membranes. And so it is important to remember that the virus does not like ooze out of the skin pores of the infected person. So if somebody is sick and they've just washed their hands and then they touch something and then you touch it, that doesn't mean that there's any virus on that. They have to like off into their hand and then touch it and then you touch it and then you touch your face. So there is a few more steps in this one, which is why it seems that it is much probably easier and viable that the person-to-person transmission is going to be what happens. But we still have to do all the cleaning as a precaution. So to simplify those risks in terms of questions that you can actually ask in terms of defining what you want to do in your business and what kind of controls to put in place, the first question, which will be your priority again, is how can we keep people at least 2 meters apart? And the 2 meters is maybe adaptable as regulations and stuff change. Some countries are already only doing 1 meter, but in Canada at the moment it's 2 meters. So if that's not possible, then how can we prevent people from getting respiratory droplets on each other if they have to be under 2 meters apart? And this larger font on this slide is more corresponding to the higher level controls, and the smaller font is more like the administrative and PPE type of controls. The next question is, how can we ensure people do not have to breathe the same air for extended periods of time? So this would be about the small droplet transmission. And then how can we prevent people from touching things that might have infectious droplets on them? And if that's not possible, how can we ensure people are able to wash their hands after doing so? So to perform a risk assessment using these questions, and you can feel free to look at the worksheet if you have that right now with you. So first you would consider the unique tasks that your business performs and break down each job duty into a list of steps. And at the steps, like if your business is Subway, for example, the steps are not, put lettuce on the bun, put tomatoes on the bun, put cheese on the bun. Those aren't 3 steps. The step would be like make the sandwich as per the customer's order. So it's kind of a unique task that would have its own transmission risks. But once you start seeing a whole bunch of different risks, then maybe that's time to break it up into more tasks. Then you would consider the potential for each transmission risk in each step. And then start from the top of the hierarchy of controls. So that would be elimination. Consider what controls you could implement for this to lower the transmission risk. So the higher level, more foolproof controls, usually maybe they would have a one-time setup cost, so it might seem a little more expensive, but in the long term, they are likely to be cheaper than continually buying PPE and disposable items and things like that. So if you've gone through this and you're finding that your only feasible controls are administrative and PPE type of controls, the things you want to consider are that these will likely have ongoing per use costs, and will they be sustainable long term? Because this isn't something that we're thinking is going to be done in the next 2 weeks. Like, it is very likely that this will last a year or more. And so can you sustain these controls if we have to do this for the next 2 years? And then the other question, because these are the controls that really rely on human behavior and humans behaving properly in order to keep each other safe, is that can you rely on your customers actually following the rules consistently to keep your employees safe? And if you can't, then you want to really go back to that drawing board and try and think a little bit more outside the box about what you might be able to implement so that everybody is going to be safe and you're not constantly policing customer behavior. So I'm going to go through the full hierarchy now and just kind of give some examples of what each step means specifically with respect to these COVID transmission risks, and some examples that have been talked about or might be listed in things like Reopen Saskatchewan. So you can just see how it fits into the hierarchy and why these things have been recommended so far. So for elimination, what you want to eliminate is the need for people to be less than 2 meters apart, eliminate the need for multiple people to touch things, and eliminate the need for multiple people to be breathing common air for extended periods of time. So some common solutions for this are to perform tasks remotely. So everybody who's working from home right now, this is effective elimination. You are not coming into contact with your coworkers. There is no risk of you transmitting COVID to each other. The other common solution is just to stay closed, which is not probably feasible anymore for a lot of you. And so that's that's just how it is. So you probably can't use elimination in a lot of customer facing tasks within the service or tourism industry, because to stay open, you need to have customers and employees in the building. So there will be some examples of how elimination can effectively work within your industry, but it's probably not going to be the main one that you end up employing. So substitution is about substituting the need for people to be less than 2 meters apart, substituting the need for multiple people to touch things, and substituting the need for multiple people to be breathing common air for extended periods of time. So some common solutions here is curbside pickup or delivery. So you're substituting customers actually having to come into the business. And as I mentioned, I think in some hierarchy of control documents and stuff, they do combine elimination and substitution. And it's just important not to get too hung up on whether something is substitution or elimination when you're going through this process. As long as you understand that it's something that's more of a higher level control, that's all you really need to worry about. Like, don't be too hung up in categorizing. Having customers seat themselves instead of interacting with a host, or using like a chalkboard or a digital menu instead of handing out menus that you have to be constantly touching. Using disposable items like disposable cutlery or menus or things like that. This, though, may not be what you consider sustainable. So that's another consideration. And then conducting some business activities outdoors. So this would substitute indoor ventilation for what we know is a lot more safer outdoor ventilation. Engineering. So I know engineering sounds maybe like kind of a fancy word, but this doesn't mean you have to have an engineering degree or hire an engineer to develop any of the controls for you. It's just all about designing out the hazard from the system. So would be designing out the ability of people to be less than 2 meters apart, or designing out the ability of people to cough in each other's faces, designing out the ability of multiple people to touch things, designing out the ability of multiple people to breathe common air for these extended periods of time. So some common solutions that we've seen that are engineering controls. So plexiglass barriers at counters are a very effective and common engineering control, but will only be as effective as how well you install it. I've seen some really small ones that would be very easy to cough over. So think about that when you're designing these controls. Extending countertops so that you physically cannot get within 6 foot of the cashier. This works really well. And maybe putting up barricades in aisles to more effectively direct one-way traffic than just having arrows on the floor. For the touching, having on-off motion sensors in bathrooms, automatic doors, or even just propping a door open and not having people have to pull it open. That's a really simple engineering control you can do. And then improving indoor ventilation as well. So just having windows open can be that simple. Keeping your bathroom vent fans running so that air is always venting out. So if somebody, for example, goes in the bathroom and coughs, then that air is continually vented out. And or even in spaces where you don't have any other options, putting in air purifiers may help a little bit as well. And then I've got a couple examples on the slide of some kind of fun engineering controls, because maybe engineering is a bit of a boring word, but that doesn't mean that the controls have to be boring themselves. So the one on the left is from the Regina Public Library, which is super awesome. It's for their curbside pickup of books. So the librarian takes the books and they put them at the top of this alligator slide, and they slide them down the stairs to the person. So they don't have to get within 6 feet of them to hand them their books, and they also get to use something really fun. And similarly, these bumper tables that I think a restaurant or a bar in Maryland has been using, so they don't allow people to get within 6 feet of each other, but it's also kind of a fun novelty. And that's really like kind of the ultimate goal with like design and safety controls, is to have people like want to use the really safe systems and not just begrudgingly use them. So I would challenge you to try and come up with a really fun engineering control if you can. Just a bit on the note of ventilation, there's not a lot of stuff about ventilation in a lot of guidelines that I've seen. For example, Reopen Saskatchewan to date doesn't really talk about it, but I do think it is something you should consider, especially if you know that your business has poor ventilation, if you're in an old building, for example. So these guidelines that were created by the American Industrial Hygiene Association, called Back to Work Safely guidelines, they do give you some ideas of what good ventilation means and what questions you might want to ask an HVAC technician if you're doing a ventilation evaluation of your business. So you can check out this website. All this stuff is free. It is American, so just be aware that some of the things that might be in there might sound a little bit different than what I'm talking about in Saskatchewan, but the ventilation stuff is sound. And moving to administrative controls. So now you can start to see there's a bit more words on the slide, and this is actually reflective of the fact that administrative controls are going to be a bit more cumbersome and have a few more things to consider and rules to follow. So it's all about making policies or procedures or training for keeping people 2 meters apart, or preventing people from coughing in each other's faces, preventing people from touching things that might be infected, or making sure they can wash their hands after, and ensuring people don't breathe common air for extended periods. So some common solutions are the 6-foot indicators in lineup areas or directional markings. And as you can see, like, these are there to remind people, but if people don't follow them, they're no longer going to be effective. They're not foolproof, they're not idiot proof. And similarly, cleaning things that have been touched or used, and having a hand hygiene policy. And I've heard some people say that like washing your hands and cleaning things is actually elimination, because you're eliminating the virus off of your hands or objects. But if you don't clean them properly, or you don't wash your hands for the full 20 seconds with soap, you can't be guaranteed that you have fully eliminated any virus that might be there. So this is why I classify it as an administrative control, because it relies on human behavior. Limiting capacity or time in a business is an administrative control. Having a no small talk policy, or having a non-medical mask use policy. And just regarding non-medical masks, it's fairly well established that they should not be considered to be PPE, which is why I'm not putting them in the PPE category. At the same time, maybe they're a little more of an engineering control, but since they rely so much on human behavior to be effective, they're kind of a hybrid of all of the lower level controls, and so I'm putting them in the administrative control section. And again, these are ones that really rely on people actually following the rules and seeing what the rules are and understanding them in order to keep everybody safe. Personal protective equipment. So this is all about wearing equipment that, if it's used correctly, it's officially rated to protect you from breathing in infected respiratory droplets or getting them on your mucous membrane. So they need to be, if you're using personal protective equipment, it needs to be approved as personal protective equipment. And some examples are a medical grade surgical or procedural mask, a medical gown or safety glasses, or if you do have an aerosol risk in your workplace, respiratory protection like an N95 respirator. If you're using respiratory protection, you need to follow the specific OHS regulations for this. You can't just buy a bunch of N95s and hand them out to your staff. You might as well be using a surgical mask if you're going to do something like that. And I'll explain that in a couple slides. So what is the deal with masks? I could talk about masks for about 5 or 6 hours if you want. So if you want to get into a long conversation, give me a call and we can talk about it as much as you want. But non-medical masks, as I mentioned, so that's like a cloth mask, masks that have been kind of deemed to be counterfeit KN95 that don't filter effectively are not considered PPE. PPE stands for personal protective equipment, and so it is supposed to be to protect you from the hazard that is around you from getting that into your system. So something that protects others from you, as we say that cloth masks do, is not PPE. It's maybe more of an administrative control. So if you've done your risk assessment or the Reopen Saskatchewan guidelines or other guidelines you have to follow, say that you need to have droplet or respiratory PPE, it has to be approved as adequate PPE for COVID-19. So you can't just use a cloth mask if it says you need PPE. This is a Health Canada approved surgical mask or respirator. And to be effective, PPE has to be used properly. I've said that lots. What does that mean? Means according to the manufacturer's instructions and any associated safety regulations for PPE. In the Saskatchewan regulations, you can see the OHS regulations section 87, which talks about all the things you need to do if you're actually having workers use PPE in the workplace. And regarding taking off masks and putting them back on again, I want to talk about this. Once you remove a mask, and the word for that is doffing, it is potentially contaminated. If you've had a chance to come into, like if you've gotten within 6 feet of another person, especially someone who wasn't wearing a mask, there's a chance that their respiratory droplets got on the outside of your mask. And if you take it off and you touch that, and then you touch the inside of the mask, then you've contaminated it. So if the mask is disposable, after you take it off, the manufacturer and public health recommendations currently say throw it out unless it's possible to disinfect it. If it's a reusable mask, like a cloth mask, also the recommendations are to wash it before putting it back on. And so if you're requiring your staff to wear a non-medical mask, so a cloth mask, then this would not be PPE, this would be more of a precautionary measure. They should be able to change them out when they need to without having to redon a potentially contaminated mask. So please don't buy your staff one mask and tell them that is your mask for your entire 8 to 10 hour shift, because the mask will get wet from normal breathing, and when that happens, they should be able to take them off. If they take them off for their lunch break, they should be able to put a clean mask on after that. If somebody coughs on their mask, they should be able to take that off and put a clean mask on as well, things like that. So they should be able to have access to enough masks to make it through the day without having to wear a soiled mask beyond its life. And then if your staff are required to wear medical masks, so actually if you have to wear surgical masks, requiring your staff to continually doff and redon these without disinfecting them could actually be considered a violation of the OHS regs, because it is official PPE, and that's against the manufacturer's regulations or manufacturer's instructions for how to use those. So just talking about when you might need respiratory protection. So what the difference between a surgical mask and a respirator, like an N95 mask, is that surgical masks are more of a splash guard. They're designed to prevent the liquid droplets from getting into the wearer's nose or mouth. So they've got kind of like a barrier material built into the mask that will prevent liquid from soaking through the mask and getting into your mouth, but they do not filter air effectively because they don't fit tightly to your face. So when you breathe in, the air pulls in through the sides of the mask or through the top or through the chin. Most of the air is coming in that way, not being filtered through that mask. And so I know there's been like studies and stuff online where people say, well, a cloth compared to an N95, and N95 filters 95% of particles, where cloth filters 50% of particles, so it's really like a cloth mask is like an N50, but that's not true, because the way to compare that would be if the cloth was tight fitting to your face and you had passed a respiratory fit test to say that there's no other air leaking in. You can't really say that the filtration efficiency is effective if it's not tight fitting to your face. So actual respiratory protection, which is tight fitting to your face, like an N95, is expensive. It's currently hard to come by if you're not a hospital, and it also requires training and fit testing to make sure it is sealing to your face properly. So if you do have an ongoing aerosol transmission risk in your workplace and you need respiratory protection, you shouldn't be substituting a surgical mask, because it's not filtering the air in the same way as an actual respirator would. If you do think you need respiratory protection, or if you're just wondering if you think you might, consult somebody who knows what they're doing in this area. So you can call me. I have experience in this area, or you could call the provincial at Sask Labor Relations and Workplace Safety, or just like one of the safety companies in Saskatoon. There will be somebody who's qualified to help you out and answer your questions on that. So a bit more on mask safety, and this graphic here is from the Public Health Agency of Canada, taken from their poster on non-medical mask use. There are people who it is not recommended that they wear non-medical masks. So if you suffer from an illness or disability that make it difficult to put it on off, if people have difficulty breathing, and this could be as simple as asthma, and children under the age of 2, these people are not recommended to wear a mask. So if you see people who aren't wearing a mask, let's be a little bit more kind and not judge as to why people are wearing them. And it's also, I don't think, appropriate for people who are not medical professionals to interrogate people as to why they're not wearing a mask either. So it's much better to encourage and not mandate, to be inclusive. And I kind of missed talking about this earlier in the presentation, but the higher level controls in the hierarchy of controls are also well known to be more inclusive controls, because they don't rely on people having certain abilities to be able to follow these more behavior specific controls. So if you put controls in place so that it's safe that people don't have to wear masks, then you're not going to have any communication issues. It's going to be better for people who are hard of hearing, and also if somebody can't wear a mask, they can still go to your business. So that's just one example. And also for your staff, if you are having your staff wear masks, but they have any concerns, or if they don't even know about this issue, but they put on the mask and they realize it is kind of hard for them to breathe, do encourage them to consult their doctor if they have any concerns. And if they come back with the doctor's note that said, no, this employee can't wear a mask, be prepared to accommodate that. This is a legitimate thing. When we put people in actual respiratory protection, there's a big questionnaire that people have to fill out and talk to a doctor about if they've checked off any medical conditions that are known to make it difficult to wear a respirator. And also, just to stress that enforcing customer behavior can be very stressful. And so if you are asking your staff to enforce like mask wearing, for example, make sure that the behavior is going to actually reduce risk. And it's also a reasonable expectation. Again, like I don't necessarily personally think it's reasonable for a receptionist at a certain business to be grilling people about their medical conditions and judging as to whether their asthma is severe enough that they can or can't wear a respirator. That's not really in your scope of practice. So just to keep in mind. And so just before we go into the examples on the worksheet, I do want to talk about the word should, because this word I think is confusing a lot of people in the various guidelines that have come out. And so it's there to incorporate flexibility, because if everything said shall, then it would be potentially forcing businesses to do things that they never would have even been having to do before. It just wouldn't work for their business and it wouldn't fit into it. So it is there to incorporate flexibility. So it's not shall, so it doesn't mean you have to do it, but it also doesn't mean that if you feel like it either. If it is feasible, then do it. That's what should means. Or if you don't do it, just be prepared to explain your reasoning to customers or inspectors. And that's not a bad thing. One example I can think of is like, I guess like if you have a customer come in and say, I don't like the fact that your cashier isn't wearing a mask, I don't feel safe. And you could say, well, here's what we've put in place. We've done our risk assessment. We have this plexiglass shield between the cashier and the customers. We have our front door right next to the cash register are propped open to improve the ventilation. And so we feel that this is going to be a lot, you're adequately protected. Our cashier is adequately protected because they're not physically able to get other people's respiratory droplets into them in this way. And so this also is helpful for communication if people need to lip read a bit and things like that. So that would just be how you explain that, and there's nothing wrong with explaining it in that way as long as you put other things in place. So now to use the risk assessment worksheet. We're almost done. So the way I would recommend it is like just kind of, if you can, forget that you've seen Reopen Saskatchewan or any additional guidance that you've been given by a different professional organization, and just start from total scratch if you can. So use the worksheet and the guide documents that are provided by Tourism Saskatoon. Break each job at your business into steps, as I was talking about before, and this would be the way it is performed before COVID, if you can remember that far back. So we really want to start from scratch and not think about what you've put into place now, unless you've adapted your business so much that there's no going back. And then perform the risk assessment for each step and suggest the possible controls that might work using the hierarchy of controls. So ideally, this would be done by the staff who actually do these jobs and not just like the manager of the business. This would be reflective of their workers' rights in Saskatchewan to be aware of the hazard and to actually participate in controlling the hazard in the workplace. So then once you've done this, now go back to the existing guidance and then reconcile what you've suggested with the requirements. Maybe they had some ideas that you didn't think about, or just make sure everything is kind of covered. And then make your final decision. So it might be a mix of short-term decisions to do, in the next 2 weeks, and then things to look into or save money for in the long term. So we're going to go through the 2 examples on the worksheet, and I know not everybody watching this owns a restaurant, and so I was just using a couple restaurant examples. But keep in mind as well, this is not what I think is like the very best thing that you need to do for this case. This is literally just an example of how you might go about it. This doesn't mean you have to do this for this specific task in your business if you are a restaurant owner. So the example here is to take the customer's order as it would have been done before COVID. So the server verbally communicates with customers at the table and retrieves menus. So then you ask, what are the transmission risks here? Is there person-to-person transmission risk? Yes, there is, because they would be less than 2 meters from the customers. And is there contact transmission risk? If you're handing menus back and forth, there's also contact transmission. So then you go through the hierarchy of controls and say what would be some potential controls to implement at each level. So for elimination, this could be pre-ordering online. So now you're completely eliminating this step, and this could be considered substitution too. So again, let's not get hung up on what goes where necessarily, but this is an example of a higher level control. A substitution could be putting a chalkboard menu on the wall or using disposable menus. Engineering could be putting a plexiglass at the cashier and then having customers order at the counter instead of at their table. Administrative controls could have customers wearing masks until their food comes, putting marking on the floor for where the server needs to stand to make sure they stay 2 meters away, and then disinfecting the menus after they get handed back and forth. And PPE would be server wearing a surgical mask when they're taking the order. So then consider the feasibility of these controls. So I've got the symbols just to represent cost and social considerations. And so elimination feasibility, maybe it would be for pre-ordering online, could be a low or high cost depending if you use fancy software or just have people email in their orders. This is also not going to allow for walk-in customers, so maybe that's something to that is going to not work for you. Substitution, so this would be chalkboard menu or disposable menus. It's low cost for a chalkboard menu, but maybe the environmental and even financial costs of continually doing paper menus might be high. For engineering, the plexiglass is kind of a mid-range one-time cost, but it is effective. But there might be space limited for custom, and you don't want to have customers gathering the counter to order, so maybe that's not possible. Administrative controls would be kind of a high ongoing cost to continually disinfect menus. Customers might not like wearing masks, or they might also just not wear them properly. They would have communication issues anyway, so they might be pulling them down to talk, which would kind of negate the whole point of having this control in place. And then the PPE, there is always ongoing costs of PPE. And this again could create communication issues. So the final decision you might come to, and again, this is just an example, you might say, we're not going to have walk-ins, we're going to do reservation only for the time being, and customers have to pre-order when they're making their reservations. And we'll try this to start, but if we're not getting enough customers this way, then maybe we'll add the chalkboard menu option and have people order at the plexiglass cashier. The second example, this would be a customer task. So it's important in this case to consider these customer tasks as well. And so this one would be just customers sitting at their table to socialize and eat. And I'm specifying that the transmission risk here would be between parties at different tables, not people who've chosen to go out to dinner together, even if they're not from the same household. That is their decision. It's not up to you to decide who should be and shouldn't be going out together. The transmission risk here is more likely to be person to person if the tables have really tight spacing. If there's less than 2 meters between the tables, then that would be more of a person to person and likely not a contact transmission. People probably aren't touching stuff at other people's tables. So some possible controls here. Elimination, you could just, to not have this, you could just keep doing takeout and delivery. Substitution would be to just do outdoor dining. So you're substituting that indoor ventilation for outdoor ventilation. Engineering could be to space tables 6 feet apart, prop open your outside doors and windows for better ventilation. Administrative would be limiting your restaurant capacity, having customers wear masks until their food comes, and implementing a time limit for how long people are allowed to stay in the restaurant. And PPE is not applicable for customers. It's just not really something that you can mandate, that because PPE is an employer mandated thing for employees, and so it's just not really applicable for customers. For feasibility of all these, so maybe you're not bringing in enough profits doing takeout and delivery only, so maybe that's just not feasible. For substitution, outdoor dining might be something that people really want to do, but again, it's like seasonal, and you don't have any available space right now because you're just on a sidewalk. Engineering feasibility, so yes, you could space the tables, but it's going to limit the amount of people in there. And then opening doors is free and easy to do. Administrative controls, so the capacity for the restaurant is required by Reopen Saskatchewan, but it's going to limit the amount of money you get. Customers might not like a mask policy or maybe not use their masks properly anyway. Not everyone can wear masks safely, so that may exclude a certain amount of people from being able to come to your business. And then they may also not appreciate a time limit. So lots of things to think about with administrative controls. And so maybe your final decision would be to follow Reopen Saskatchewan for table spacing and capacity, keep the entrance door propped open if the weather permits, and encourage quick turnarounds, maybe by using online, maybe reservation only type of system like we talked about in the other example, and maybe figure out if there's any way you can implement a parking space patio in the future. So that is the second example. So that's about it. These are just the resources that I touched on throughout the presentation. Obviously, Reopen Saskatchewan, the version is of June 16th, 2020. I don't remember if I talked specifically about WorkSafe BC, but their hierarchy, they include the hierarchy of controls in their COVID-19 guidelines for various types of businesses. So if you're interested in checking it out, WorkSafe BC is always awesome, and there's lots of good information over there if you're looking for additional guidance. The NIOSH hierarchy of controls, you can just Google that and find lots of information if you want to read up more on it. If you're looking for information about PPE for COVID, you can go to the Sask Health Authority website about information for healthcare providers, PPE infection prevention and control for COVID-19. Tons of posters and information on how to use it properly and training and all that kind of stuff. And the ventilation stuff in the American Industrial Hygiene Association Back to Work Safely guidelines, Public Health Agency of Canada, the non-medical mask poster is a really good poster to even maybe just grab a copy of and have in your business to remind your staff about how to use it properly if you're going to be using that at your place of work. And just a disclaimer, kind of be careful if you're using other jurisdictions' guidelines, especially regarding PPE, because different jurisdictions are saying different things about PPE, so just make sure you're following the Saskatchewan guidelines for that. So here's my contact information if you have any questions, if you want some facilitation for your risk assessment, if you just need any clarification or you want to talk about any of this more, you can contact me through this email address, or you can contact Tourism Saskatoon and they will put you in touch with me. And I am contracted for the next few weeks to provide the service for you, so it's totally free for you if you want to contact me and have me help you out. So that's about it. Thank you so much for attending, and I'll turn it back over to Steph for a bit.
Thank you so much, Robin. It has been such a pleasure working with you, and I'm really grateful for this information. So just a recap for everyone, what's really important to note is that this is a resource. We are not looking to augment or create any more processes. This is just an opportunity for us to really support your businesses and to unify all of Saskatoon around this amazing new initiative. So please visit our website, and after you've watched this webinar, you can go ahead and download the worksheets. And then once you're done with that, please reach out back to us and through our website, fill out the forms that are needed to become one of the community commitment partners. Robin, thank you so much for all that you do. Thank you so much for supporting our industry around safety and security. Right now, it is about our people, it is about our community, and all of the visitors that will come in the future. So Saskatoon is known as one of the safest and securest places in Canada, if not the world. Thank you so much, everyone, today for joining us, and we look forward to working with you. Thanks so much, Robin.